Hey everybody, welcome back to Drug Talk. As always, I'm your host, Garrett Campbell. Today we're going to be discussing a medication known as Meperidine. Its brand name is Demerol. And before I talk about the medication itself, just keep in mind that this channel is for information purposes only and not to be used as a source for recommendations for your personal health care. And quickly, if at any time during this video you find this information to be valuable, please consider leaving a like on the video as it would really help me with the YouTube algorithm. So first, what will we cover in this presentation? We'll start by talking about how Meperidine works. We'll then discuss indications or reasons we would prescribe Meperidine to a patient, followed by contraindications or reasons we would not be able to prescribe this medication to a patient. Then we'll discuss examples of dosing, and then stick around to the end where we'll talk about side effects. So how does Meperidine work? Well, Meperidine is a narcotic analgesic or pain medication. It has similar effects on the central nervous system and smooth muscle as morphine. It mainly acts as an analgesic and a sedative. Now, in terms of indications or reasons we would prescribe this medication to a patient, it can be used as an adjunct for anesthesia. This medication can be used for obstetric pain, which would be pain related to childbirth. Patients use this medication for moderate to severe pain, and it can also be used as a pre-medication for procedures. Now, with respect to contraindications or reasons we would not be able to prescribe Meperidine, we wouldn't be able to give it to patients who have a hypersensitivity to Meperidine or to any other component of the formulation. Patients with significant respiratory depression would not be able to use this medication, as well as patients with acute or severe bronchial asthma if they're in an unmonitored setting without the necessary resuscitative equipment available. We wouldn't use this medication within 14 days of a monoamine oxidase inhibitor. And lastly, we wouldn't give it to patients who have a gastrointestinal obstruction. Now, what about dosing with Meperidine? So when it's being used to treat adverse reactions associated with anesthetics, patients would typically receive 0.2 to 0.5 milligrams per kilogram as a single IV dose or intravenous dose. For oral dosing, the initial dose would typically be 50 to 150 milligrams orally every 3 to 4 hours as needed. Now, as with all medications, there are some side effects or adverse reactions that patients may experience while using Meperidine, so I'll go over some of those here now. Some patients may experience nausea and vomiting, while others may experience dizziness or lightheadedness. Sedation and sweating are also possibilities. Now, some more serious side effects would be hypotension or low blood pressure, orthostatic hypotension, which would be a sudden drop in blood pressure when going from a seated to a standing position, syncope or fainting, respiratory arrest or respiratory depression, serotonin syndrome, or drug withdrawal. That's all we're going to talk about today with Meperidine or Demerol. As always, I'm very thankful you took the time to come by and watch one of my videos. If you found the information valuable and you'd like to help grow this channel, you can like the videos, share the videos, or most importantly, subscribe to the YouTube channel. There's also some links in the description you can check out as well. That's it for today. Take care.